Welcome to the module on snake bite and animal bite. By the end of this module, you will be able to identify the signs and symptoms of poisonous snake bite, explain the complications of snake bite, identify the types of anti-snake venom, explain the PhD for snake bites, identify other types of animal bites, describe the procedure for animal bite wound care, explain how to prevent animal bites, and explain the role of volunteers. Let us begin by understanding the reasons for snake bite deaths in India. There are a large number of snake bite deaths every year in India. This happens due to three main reasons. There is lack of adequate medical infrastructure, strong belief in myths in the community, and lack of trained doctors or people in the community. Do you know that only about 20% of the total snake species found in the world are poisonous? The other 80% of snakes are non-poisonous. The venomous snakes include only about 58 species, out of which there are only 4 species of snakes that are dangerous to people. They are cobra, kret, Russell's viper and saw-scaled viper. India has been recognized as having the highest snake bite mortality rate in the world. Most of the fatalities are due to victims not reaching the hospital in time. Most snake bite deaths are preventable. Almost 300 species of snakes exist in India, out of which only 50 species are poisonous. Let's look at the 10 deadliest snakes in India. They are Russell's viper, Indian kret, saw-scaled viper, spectacled cobra, king cobra, hump-nosed pit viper, Malabar pit viper, bamboo pit viper, Indian rock python and yellow-lipped sea kret. Now that you know about the 10 deadliest snakes in India, let me walk you through the signs and symptoms of poisonous snake bites. Snake bites are quite common in some parts of the country. We must treat all snake bites as poisonous. Signs and symptoms of a snake bite may be delayed. Death can occur quickly if the patient has an allergic reaction to the venom. Roll over each hot spot to know about the various signs and symptoms of snake bite. Now that you have learnt about the signs and symptoms of poisonous snake bites, let me tell you about the complications of a snake bite. Let's learn about the complications a snake bite can cause. Drag and drop each tab in the drop box to know more. Snake bites can cause myocardial infarction due to vasospasm or coronary artery thrombosis, cardiac rhythm disturbance, pulmonary edema, hypertension, neurological complications. It can also cause stroke, paralysis, ptosis, ophthalmoplegia and respiratory failure. Some venoms poses anticoagulants and cause excessive bleeding. Cerebral hemorrhages can be fatal. About 20% of people who die after a snake bite would have suffered cerebral hemorrhages. Other toxins are procoagulants that cause widespread clot formation, followed by defibrinogenation, making patients more vulnerable to strokes. The toxic effect of snake venom results from both the protein and non-protein elements of the venom. It is further complicated by the inflammatory response of the victim's body. It damages red blood cells, leukocytes, platelets and skeletal muscles. The venom also affects vascular endothelium, peripheral nerve endings and the myoneural junction. Snake bites can cause local complications like pain, swelling, vision damage or corneal ulceration due to venom spray, compartment syndrome, necrosis, gangrene, infection and chronic ulceration. So far, you have learnt about the complications of snake bite. Next, let me tell you about the different types of antivenom serums available. Let us also learn about the pre-hospital treatment for snake bite. The mainstay of primary treatment for snake bite has been the administration of antivenoms. Antivenoms work by boosting our immune response after a snake bite. They are made by immunizing donor animals such as horses or sheep with snake venoms. These animals have robust immune systems and produce powerful antibodies that can bind to snake venom components, enabling our own immune defenses to eliminate these toxins. Antivenoms are obtained by harvesting and then purifying the antibodies from plasma produced by the donor animal. Good quality antivenoms can literally make a difference between life and death. There are two types of antivenom serum. They are monovalent or monospecific species specific and polyvalent effective against several species. As per the recommendations of WHO, the most effective treatment for snakebite is the administration of monospecific ASV. However, this therapy is not always available to snakebite victims. This is because of its high cost, frequent lack of availability, and difficulty in correctly identifying the snake. Polyvalent or polyspecific antivenoms are produced with the purpose of neutralizing multiple snake venoms. Hence, they can provide effective therapy against a selection of snakes within a geographical area. It is expected that the widespread adoption of polyvalent antivenoms or PAVs will negate the necessity of identifying culprit snakes. Next, let us know about pre-hospital treatment for snake bites. In case of snake bite, use universal precautions and secure the scene, move the patient to a safe place, calm the patient and try to place him or her in a comfortable position, locate the bite marks and clean with water and soap. Remove rings, bracelets or any restrictive garments from the affected extremity. Do not apply tourniquets. Do not make incisions around the bite marks and do not try to suck the venom from the wound. Treat for shock and provide basic life support as needed. Do not give the patient any food or drink. If possible, capture the snake for species identification, administer oxygen per local protocol and continuously monitor the patient during transport. Only antivenom works as an antidote for a poisonous snake bite. Serum must be administered based on 3 criteria. They are specificity appropriate to the snake species, appropriate quantity and within the shortest possible time. Answer the question by choosing the appropriate option and click Submit. Let us next learn about animal bites. An animal bite can break, puncture or tear the skin. Animal bites that break the skin put you at risk of infections. Let us now learn about the causes of animal bite and the symptoms. Click each tab to know more. Most animal bites come from pets. Dog bites are common and most often happen to children. Compared with adults, children are much more likely to be bitten on the face, head or neck. Cat bites are less common but have a higher risk of infection. Cat teeth are long and sharp and can cause deep wounds. Most other animal bites are caused by stray or wild animals, such as skunks, raccoons, foxes and bats. Bites that cause a puncture wound are more likely to become infected. Some animals are infected with a virus that can cause rabies. Rabies is rare but can be deadly. Animal bite can cause pain, bleeding, numbness and tingling. The bite may also result in breaks or major cuts in the skin, with or without bleeding, bruising or discoloration of the skin, crushing injuries that can cause severe tissue tears and scarring, punctured wounds and tendon or joint injuries resulting in decreased motion and function of the injured tissue. Next, let us learn how to take care of the wound. As there is risk of infection, you should see a doctor within 24 hours for any bite that breaks the skin. If you are caring for someone who was bitten, calm and reassure the person. Wash your hands thoroughly with soap and water before treating the wound. If the wound is bleeding, put on latex gloves, if available, and wash your hands again afterwards. To care for the wound, stop the wound from bleeding by applying direct pressure with a clean dry cloth. Wash the wound. Use mild soap and warm, running water. Rinse the bite for 3 to 5 minutes. Apply an antibacterial ointment to the wound. This may help reduce the risk of infection and put on a dry, sterile bandage. If the bite is on the neck, head, face, hand, fingers or feet, call the doctor immediately. For deeper wounds, you may need stitches. The doctor may give you a tetanus shot if you have not had one in the last 5 years. You may also need to take antibiotics. If the infection has spread, antibiotics may be administered intravenously. For a bad bite, you may need surgery to repair the damage. Wild animals and unknown pets may be carrying rabies. If you have been bitten by a wild or stray animal, contact your doctor immediately. See a doctor within 24 hours for any bite that breaks the skin. Call the doctor or go to the emergency room if there is swelling, redness, or pus draining from the wound. The bite is on the head, face, neck, hands, or feet. The bite is deep or large. You see exposed muscle or bone. You are not sure if the wound needs stitches. The bleeding does not stop after a few minutes. For serious bleeding, call 112 or the local emergency number. You have not had a tetanus shot in 5 years. Rabies from animal bites can be deadly. Remember the dog's appearance, seek medical help and avoid harming the dog. Spread awareness about yearly dog vaccinations. Most animal bites heal without infection or tissue issues. Some wounds need surgery for proper cleaning and closure. Sometimes, even minor bites might require stitches. Deep or extensive bites can lead to significant scarring. Complications include fast-spreading infections and tendon or joint damage. There is a higher risk of infection in people with weakened immune systems, diabetes or arterial disease. Rabies shot after a bite prevents the disease. Let us now learn about situations when we need to call animal control, municipality or corporation. You should call animal control or local police if you are bitten by an animal that behaves in an odd way, an unknown pet or a pet that has not had a rabies vaccination or a stray or wild animal. Tell them what the animal looks like and where it is. They will decide whether the animal needs to be captured and isolated. Next, let us learn how to prevent animal bites. In order to prevent animal bites, teach children not to approach strange animals, do not provoke or tease animals, do not go near an animal that is acting strangely or aggressively. It may have rabies, and do not try to catch an animal yourself. Let us next learn how to prevent dog bites. Dogs can be your best friends. However, when they are angry or scared, they might bite. Let's learn to live together responsibly and safely to prevent being bitten by dogs. Drag the cursor on each icon to learn tips to prevent dog bites. Don't disturb or frighten dogs, particularly when they are eating or tied up. Don't disturb dogs when they are with toys, puppies in a car, behind a fence or when asleep or ill. Keep away from dogs when they are angry or scared. When dogs are angry, they will show teeth. When they are scared, they put the tail between the legs and try to run away. Don't move if a dog approaches you when it is not on lead. Stand still like a tree trunk. If you fall over, curl up and stay still and heavy as a rock. Approach dogs slowly and quietly. Ask the dog's owner or your parents or guardian's permission before you touch a dog. Let the dog sniff your hand before you touch a dog. When you stroke a dog, do it on the back first. If a dog bites, act quickly. Wash the wound with soap and water and look for a first aid center. Remember to tell your family friends that you were bitten. Tell them which dog it was and where you were when the dog bit you. Now, let us learn about the role of a volunteer. Volunteers help rescuers in carrying injured victims, manually or with a stretcher. Volunteers help medical staff in maintenance of basic life support system. Volunteers are supposed to provide moral support in animal bite cases. Volunteers must be aware that the condition of certain patients calls for special techniques so that the injury may not get aggravated. In such a situation, they should wait for a doctor. The key points discussed in the module are: India has high snake bite mortality rate due to lack of medical infrastructure and myths. Only 4 species of snakes are dangerous to man, namely cobra, kret, Russell's viper and saw-scaled viper. Snake venom damages blood cells, muscles and nerves. Snake bites cause cardiac, respiratory and neurological complications. Animal bites can also lead to infections. Keep away from dogs when they are angry or scared. For deeper wounds, you may need stitches, antibiotics, and a tetanus shot if you have not had one in the last 5 years. Now, it is time to check your understanding of the topic. This is an evaluation exercise. All questions are equally weighted. You need to score at least 60% to pass the test. Read the questions carefully and select the appropriate options. Congratulations!